Can stopping drugs reverse drug-induced lupus? Can stopping certain medications reverse drug-induced lupus? This is an important question for many individuals who may be experiencing symptoms of lupus after starting new medications. Drug-induced lupus is a form of lupus that can occur as a reaction to specific drugs. It is important to understand how this condition works and what can be done about it. Drug-induced lupus occurs when the immune system reacts to certain medications, causing symptoms similar to systemic lupus erythematosus, which is the most common form of lupus. The symptoms can include joint pain, fatigue, and skin rashes. Not everyone who takes these medications will develop drug-induced lupus, as individual responses can vary widely. Common medications associated with drug-induced lupus include hydralazine, procainamide, and isoniazid. These drugs can trigger an immune response that leads to inflammation and damage to healthy tissues. The exact mechanism behind this reaction is still being studied, but it is believed that genetic factors may play a role in who develops this condition. The good news is that stopping the offending medication often leads to an improvement in symptoms. In many cases, symptoms can resolve within weeks to months after discontinuation. However, this does not mean that drug-induced lupus is the same as other forms of lupus. It is generally considered to be a temporary condition, and the symptoms may not persist once the medication is stopped. It is essential to consult a healthcare professional before making any changes to medication. A doctor can help determine whether the symptoms are indeed related to drug-induced lupus and can provide guidance on how to safely discontinue the medication. In some cases, alternative treatments may be necessary to manage the underlying condition for which the medication was originally prescribed. While stopping the medication can reverse drug-induced lupus for many, individual experiences can differ. Some people may find that their symptoms improve quickly, while others may take longer to recover. Monitoring and follow-up care with a healthcare provider are crucial during this process. In summary, stopping the medication that caused drug-induced lupus can often lead to a reversal of symptoms. However, it is vital to approach this process under the guidance of a healthcare professional to ensure safety and proper management of any underlying health issues. Understanding the complexities of lupus, including drug-induced lupus, can empower individuals to make informed decisions about their health.